The nurse is assessing fetal heart rate in a pregnant patient. The nurse records a pulse of 82 beats per minute. The nurse should dash. A. Ask the mother to lay on her right side. B. Call the physician immediately. C. Try another Doppler device. D. Add lubricant to the Doppler's surface. E. Move the Doppler device. The answer is E. Move the Doppler device. An 82 beat per minute reading could be the mother's heart rate, indicating that the nurse does not have the Doppler in the correct position. A normal fetal heart rate is between 120 and 160 beats per minute. The nurse must always remember to take the mother's pulse before assessing the fetal heart rate. Before calling the physician, it is important to determine that the data is accurate. To increase oxygen perfusion to the fetus, ask the mother to lay on her left side. Brittany is 40 weeks pregnant and calls because she is seeing pink-tinged discharge for the first time. The nurse should tell Brittany to dash. A. Continue to monitor. B. Call an ambulance. C. Lie on her back and place her feet in the air until help arrives. D. Drive to the hospital immediately. E. Eat a bland diet and continue regular exercise. The answer is A. Continue to monitor. This is most likely the normal bloody show at the beginning of labor. There is no need to immediately arrive at the hospital, change position, or eat a bland diet. The patient should continue to monitor and call back or seek care when she experiences regular contractions that are becoming more intense and frequent. Sarah is a 17-year-old female who has not gotten her first period and is visiting her doctor for an exam. She has displayed the normal growth and development of several secondary sex characteristics. The nurse would describe to the doctor that Sarah is showing signs of dash. A. Oligomenorrhea. B. Primary dysmenorrhea. C. Secondary amenorrhea. D. Secondary dysmenorrhea. E. Primary amenorrhea. The answer is E. Primary amenorrhea. Primary amenorrhea occurs when a female is 14 years old and has not gotten her first period and has not developed secondary sex characteristics. Primary amenorrhea also occurs when a female 16 or older has not gotten her first period but has developed secondary sex characteristics. Primary dysmenorrhea refers to painful menstruation not linked to a physiological disorder. Secondary dysmenorrhea refers to painful menstruation due to an underlying cause such as endometriosis. Oligomenorrhea refers to the absence of a period, typically for at least 35 days. Amber is a 39-year-old woman who is experiencing secondary dysmenorrhea. The nurse knows that Amber could be suffering from which of the following? A. Amenorrhea. B. Low levels of aldosterone. C. Endometriosis. D. Turner syndrome. E. High levels of prostaglandin. The answer is C. Endometriosis. Secondary dysmenorrhea refers to painful menstruation due to an underlying condition. Endometriosis, an example of a condition that frequently causes secondary dysmenorrhea, refers to the growth of uterine tissue in inappropriate places such as the ovary or rectum. High levels of prostaglandin are frequently found in women with primary dysmenorrhea, which is painful menstruation without an underlying condition. Low levels of aldosterone would not likely cause painful menstruation. Turner syndrome is a chromosomal disorder that can frequently cause amenorrhea, or absence of a period. A nurse is assessing an 18-year-old woman who has come into the emergency department for bilateral abdominal pain. Which of the following should the nurse not consider a risk factor for ectopic pregnancy? A. Neisseria gonorrhea. B. Yeast infection. C. Uterine fibroids. D. Chlamydia trachomatis. E. Endometriosis. The answer is B. Yeast infection. Uterine conditions such as endometriosis and uterine fibroids increase the risk of ectopic pregnancy. Endometriosis is the inappropriate growth of uterine tissue outside the uterus. Uterine fibroids are benign tumors within the uterus. Sexually transmitted infections can cause a condition called pelvic inflammatory disease, which can result in scarring. Scarring of the reproductive system greatly increases the risk of ectopic pregnancy and infertility. Yeast infections are common after antibiotic therapy and are treated with an over-the-counter medication. They generally do not cause permanent damage to the body.